Did you know that an estimated 8.3 million people living in the United States have gout, with 6.1 million being men and 2.2 million being women? And the good news is, gout can be controlled with medications, a better diet, and a healthy lifestyle. Today's video reviews how to treat gouts with your diet. Gout is a painful kind of arthritis caused by high uric acid levels in your blood that develops when uric acid forms crystals that settle in your joints, causing swelling and pain. Purine is a chemical contained in many meals that breaks down by to produce uric acid in your body. When the uric acid is high in the body, they accumulate in the joints and triggers swelling and pain in the joints. Moving on in the video, we will discuss some foods that could potentially increase uric acid in your body and increase your risk of recurring gout attacks. But on the good side, you can reduce the level of uric acid in your body from accumulating by maintaining a low purine diet to avoid gout attacks. Most people living with gout may experience other health issues such as diabetes, kidney dysfunction, coronary heart disease, obesity, or high cholesterol that may reduce their risks of properly treating and managing gout. Let's get right into it with some of the best diet options for gout treatment, including what foods to eat and what foods to avoid. There are certain foods that can cause gout attacks by increasing uric acid levels. Commonly known as trigger foods, they contain purines, which allow your body to produce uric acid as a waste product when you consume purine-based foods. Fortunately for people without gout, there's no problem. Their body can effectively get rid of extra uric acid. Gout patients, however, are unable to effectively remove more uric acid. Therefore, trigger foods strong in purines may cause uric acid to build up and result in a gout attack. English physician Thomas describes his own gout attack, stating that you go to bed and sleep in good health. About 2 o'clock in the morning, he is awakened by a severe pain in the great toe, more rarely in the heel, ankle, or in step. This pain is like that of dislocation, then follows chills and shivers and a little fever. The pain, which was at first moderate, becomes more intense. Fortunately, research indicates that avoiding meals high in purines and using the right medicine will stop gout attacks. We've got you covered on all the information you need on your health right here for you. So why don't you go and subscribe to the channel? That way you don't miss out on any new info and updates. First of all, let's talk about some foods you should avoid if you're susceptible to gout attacks. The obvious option is foods high in purine. Purine-based foods contain more than 200 mg of purines per 3.5 ounces, 100 grams, which can easily trigger a gout attack. Another food you should avoid is high fructose-based foods. Now let's get into some major high purine foods, moderately high purine foods, and high fructose foods you should avoid. And speaking of high purine foods to avoid, there are some vegetables that have purine levels in them, but studies have shown that they are not as harmful as other high purine content foods. Keep watching and let's find out more in a moment. Number 1. Meats. These include all types of red meat, beef, lamb, pork, and bacon. Other meats include liver, kidneys, sweetbreads, tripe, and brain, which all contain high levels of purine and lead to high blood levels of uric acid. Therefore, limit meat intake or better still be a vegetarian.
Not bad.
Number 2. Alcohol. Aside from the hangover, possible vomiting, and maybe waking up in a stranger's bed the next morning, alcohol limits your kidneys from effectively getting rid of uric acid, thus drawing it back into your body, where it continues to build. Not all alcoholic beverages have high purine levels in them, so a small glass of wine is not too bad. However, avoid beers and liquors like vodka and whiskey, which are highly associated with an increased risk rate of recurring attacks. To be on the safe side, limit or totally avoid your alcohol intake. Number 3. Sugary foods and beverages. These include fruit juices, sugary sodas, candy, sweetened cereals, baked sweets, ice cream, fast food, added sugars, yeast, additives, and a whole lot. Whatever form they come in, the best advice here is to limit or avoid their intake. Number 4. Seafood. Some seafood to avoid include such as anchovies, shellfish, sardines, roe, lobster, crabs, tuna, shrimp, mussels, and others. But there are certain seafood that are higher in purines than others. Therefore, eating moderate portions of fish can be added to your gout diet.
Can't hurt to try.
Number 5. Vegetables high in purine. Vegetables like asparagus and spinach have high purine, but studies indicate that they don't increase the risk of gout or recurring gout attacks. We would touch on a sample menu that includes the consumption of veggies enough to keep your gouts in check in a bit. Stay with us. To stay up to date with our latest videos and health info tips, make sure to like, comment, and share this video. Now, let's get into some foods that can be added to your gout diet. Even while consuming certain foods won't cure gout, research shows that certain meals and beverages may assist lower levels of uric acid in the body. So inarguably, you should opt for low purine foods. Number 1. Low-fat and non-dairy fat products, such as yogurt and skim milk, are more beneficial. Number 2. Generally, all fruits are beneficial, especially those high in fiber and low in sugar content, such as cherries, which studies and research have proven have anti-inflammatory properties and also help reduce uric acid, citrus fruits, and berries.
Try it.
Number 3. Vegetables. Here, almost all vegetables are equally beneficial. Even vegetables like spinach and asparagus high in purine don't increase your risk of gout or gout attacks. Number 4. All nuts and seeds are also beneficial in the treatment of gout. Number 5. Whole grains such as oats, brown rice, and barley. Number 6. All legumes, including lentils, beans, and soybeans, are also essentially helpful. Number 7. Beverages such as coffee, tea, and green tea. Number 8. All herbs and spices are beneficial as well. Number 9. Oils such as canola oil, coconut oil, avocado oil, and olive oil. Number 10. Water, without a doubt, is the best drink for the body. It is therefore recommended gout patients drink enough water to reduce gout or gout attack symptoms. A less functioning kidney can contribute to gout. Ultimately, your kidneys make use of water to excrete uric acid in your urine.
Refreshing.
Number 11. Lean proteins, such as chicken, turkey, and eggs, can be eaten in moderate forms. You can speak to your doctor or dietitian to help prepare a suitable gout diet menu specific to your health needs. But here is a sample breakfast, lunch, and dinner gout diet menu that may be helpful for you. For breakfast, you can have a smoothie made with some blueberries, spinach, Greek yogurt, and low-fat milk, or oatmeal with milk, berries, cherries, almonds, or walnuts, and a glass of water. And also, for lunch, a salad with boiled eggs and loaded fresh veggies, fruit, avocado, and olive oil and vinegar dressing, also with a glass or 2 of water. And finally, for dinner, you can have whole wheat grain pasta with skinless chicken breast, spinach, bell peppers, and 1 to 2 glasses of water. As far as a gout diet goes, it can aid in lowering uric acid production and boosting its excretion. However, it is unlikely that a gout diet will reduce blood uric acid levels enough to treat or go off gout medication, but it might lessen the frequency and intensity of attacks. Be sure to live a healthy life by losing weight, exercising more, staying hydrated, and getting a good gout diet, coupled with your gout medications, can enhance your general health. Stay updated with your gout health. We've got you covered on that. Just check out our other video. Tired of the severe joint pains? Learn how to deal with gout once and for all. Thanks for watching.